The healthcare system in America has long been a topic of conversation. But for millions of families, it's not just a discussion, it's a daily struggle. What if the system that's supposed to heal you is actually the one keeping you sick? For many, the rising costs of healthcare have become a financial burden that feels insurmountable. What once seemed like a basic right has turned into an expensive privilege, leaving families stuck between choosing to get the care they need and going broke in the process. It's a constant battle of survival, where the rules of the game seem rigged against those who are most in need of help. For those who have insurance, the struggles don't end once they have coverage. Can you imagine having insurance, yet still facing bills that threaten to bankrupt you? High deductibles, skyrocketing premiums, and out-of-pocket costs are just the beginning. Even those who think they're covered often find themselves in the middle of a financial nightmare when they try to use their insurance. Medical bills arrive like clockwork, and they're rarely what people expect. Coverage, gaps, hidden fees, and surprise charges seem designed to keep patients in the dark, making them vulnerable to a system that profits off of their pain. But what about those who aren't insured? What if not having health insurance means living in constant fear of illness or injury? For millions of Americans, not having insurance isn't just a minor inconvenience. It's a life-altering reality. Without insurance, the cost of even the simplest medical procedure can be a crushing burden. An emergency room visit, a routine checkup, or even a prescription drug can leave families drowning in debt. The fear of needing medical care, but not being able to afford it, is a constant worry that shapes everyday decisions. While many individuals struggle with the financial burden, it's the healthcare system's overall inefficiency that makes it even worse. What if the system itself is designed to fail? In America, healthcare isn't just about medicine. It's about bureaucracy, red tape, and a system that feels like it's built to frustrate and confuse. Medical billing is often a nightmare, with multiple layers of complexity that patients must navigate. For a system that's supposed to provide care, it's ironically structured in a way that seems more interested in profit than in actually helping people. And then there's the reality of prescription drugs. What if a simple prescription could cost you more than your rent? The skyrocketing prices of medications have put life-saving drugs out of reach for many, even those with insurance. The cost of medications in the United States is among the highest in the world, leaving patients to choose between filling their prescriptions and paying for other essentials. This creates a brutal situation where people have to make impossible decisions, sacrificing their health for the sake of their financial well-being. Even those with relatively good insurance are often left with an overwhelming financial burden when faced with a major health issue. Can you imagine being diagnosed with a life-threatening illness, only to find that your insurance won't cover your treatment? Many people have had this nightmare become a reality. Insurers often find loopholes to avoid paying for expensive procedures or treatments, leaving patients to foot the bill. Treatments for cancer, chronic conditions, and surgeries can run into the hundreds of thousands of dollars, and for many, that's an insurmountable debt. Another issue that plagues the system is the lack of transparency. What if the true cost of your healthcare was hidden from you until it was too late? For many people, the price of healthcare is a mystery. When they walk into a doctor's office or hospital, they have no idea what they'll be charged. Bills can arrive months after treatment, and even then, they often lack clarity. This lack of transparency creates confusion and distrust in the system. People are left trying to decipher complex bills that don't make sense, while the financial burden continues to mount. If this topic hit close to home, make sure to hit that like button. It really helps us keep these important discussions going. Don't forget to subscribe for more in-depth videos like this one, as we dive into the issues that matter most. But what about the elderly, who depend on healthcare more than any other group? What if your golden years were spent in a constant fight for affordable care? For senior citizens, navigating the healthcare system is an especially challenging task. Medicare, while helpful, is often not enough to cover the full range of medical services needed. Many seniors find themselves having to choose between life-saving medications, treatments, or basic needs like food and housing. They are often stuck in a system where they are forced to either pay out of pocket or go without critical care. The gap between the wealthy and the middle class in accessing healthcare is also growing. What if the best care was only available to the rich, leaving the rest of us to fend for ourselves? Wealthy Americans can afford the best healthcare, including private doctors, specialized treatments, and world-class facilities. But for the average person, accessing high-quality care is becoming increasingly difficult. Insurance plans are more expensive, deductibles are higher, and co-pays have risen, making it harder for middle-class families to afford the care they need. For the poorest in society, the situation is even worse. What about preventative care? What if the lack of affordable preventative care is why so many Americans are falling ill in the first place? The healthcare system in America focuses primarily on treating illnesses after they happen, rather than preventing them in the first place. The cost of preventative care, such as regular checkups, screenings, and lifestyle management, is often out of reach for many families. Without proper preventative care, health issues go unchecked, leading to more severe conditions later on. But it's not just individuals who are suffering, the system itself is failing on a national scale. What if the entire healthcare system in America is broken beyond repair? The system is fractured, with too many moving parts that don't work in harmony. The lack of universal healthcare means that many people are left behind, unable to access the care they need. Private insurance companies profit off the suffering of millions, while hospitals and doctors struggle to meet demand. With an increasing number of people uninsured or underinsured, the burden of paying for healthcare continues to fall on those least able to afford it. For millions of Americans, the broken healthcare system has become an insurmountable financial burden. What if the price of healthcare was so high that it destroyed your financial future? It's a terrifying reality, but it's one that too many families are facing. The financial strain caused by medical bills, insurance premiums, and prescription costs is crippling. Many Americans find themselves in debt, unable to afford the care they need, and uncertain of how to escape the vicious cycle. The healthcare system, instead of being a source of healing, has become an engine of financial destruction, leaving families trapped in a system that profits off their suffering. Thank you for tuning in. If you found this deep dive into America's broken healthcare system insightful, don't forget to hit the like button and subscribe to stay updated with more content on how rising healthcare costs are impacting millions. Stay informed and join the conversation.